Non-communicable diseases, of course, have been around for a long time, and it's traditionally or historically been a problem for high-income countries. A few decades now, we've seen a shift in low and middle-income countries such as Ghana, South Africa, Zambia, and so on, where non-communicable diseases are beginning to increase.
I think that it's about lifestyle transition. As societies are moving from low income to middle income, lifestyle changes, and due to those lifestyle changes, it comes up with those sort of diseases.
A silent epidemic is sweeping through Ghana, affecting millions of lives. Non-communicable diseases, or NCDs, are a growing threat to global health, and the cost burden is staggering.
If you ask me as a clinician, one condition I fear most, in fact I fear diabetes even more than cancer, because once your sugar is so high, it affects virtually all tissues, all organ systems in the body.
The World Health Organization reports that NCDs account for over 30% of deaths in Ghana, with diabetes prevalence doubling in the past decade and affecting around 6% of the population. Also, hypertension, often undetected until complications arise, silently impacts over 1/3 of Ghanaian adults.
About 612,000 new cases of hypertension alone are diagnosed every year. That is quite consequential in terms of the financial implications.
It's like a ticking time bomb, and if we don't address it, it's going to be catastrophic.
In this documentary, we uncover the human stories behind these statistics and explore impacts of NCDs on the affected persons, the family, the health system, and the national purse. Cedia was the only way to keep her alive.
And say time in cry in ne doctor binka ka puinaniu le ma penya gba ka maham lo esane apona no kone mo no ma pe free ne ko ba sen no se na po no hu lololu ka ke one pie lo hu enyinya gba.
Behind this show of strength is a deep-seated fear of the unknown. 2 years after the amputation, her right leg is showing signs she's familiar with. Mercy fears this could end her life.
When we talk about diabetes, we're looking at 3 key things. One is a chronic metabolic disorder. And why is the disorder? The disorder is that the person is either not making adequate insulin, or the person is producing the insulin, but the insulin is not functioning or working efficiently or effectively. So there's a problem with quantity, and there's also a problem with the quality. And then you can also have a combination of the two happening, where the insulin production is a problem and its function is also a problem. And once insulin is not working properly, then it means that the amount of sugar, what we call glucose in the blood, that the insulin has to help move into the cells of the body for the body to burn, stays in the blood. And then the sugar goes up. 1 month course of a newer anti-diabetic agent may be in the range of 400 to 600 Ghana cedi. So if the person has to be on antihypertensive as well, then you're looking at moving into the thousands.
She traces the disease to her father and uncle, a secret both men had kept from their children. Their silence may have been driven by the fear of stigma, denial, or maybe a desire to protect their loved ones from worry. This is a mistake Mercy has refused to make.
I've been following my mom to check up. So they've been telling me that because I'm the only child of my mother and then I'm the firstborn also, it can be heredity. So I should take good care of myself.
The non-modifiable risk factors may contribute between 30 to 40% of your diabetes risks, whilst the modifiable risk factors contribute almost 60 to 70%. So if you're able to handle those that you can do something about, then those that you cannot do, those you can do something about would overshadow what you cannot do anything about. Now, what are the things you cannot do anything about? That is the non-modifiable risk factors. The fact that you are black, you cannot do anything about your aging. The other thing you cannot do anything about is your genetic predisposition. That is your family history. So if diabetes runs through your family, then you stand a higher risk of also developing diabetes. Now, what are some of the modifiable things? What are some of the things we can do something about? Things like inactivity, weight gain, excessive alcohol intake, and then things like eating food that are so refined. They all put you at higher risk of developing type 2 diabetes.
Kwabena Frimpong is a pupils teacher. In his family, hypertension is not just a diagnosis. It is a generational legacy none of them asked for. His parents, siblings, and even his wife navigates the daily challenges of managing high blood pressure.
Well, with the BP, I know it is more or less a hereditary issue because in my father's line, my mother's line, it's there. As it stands now, I think I'm the fourth born of my parents, and 3 of us, myself, my younger brother after me, and my sister I come after, we are all on BP medication. My wife herself is hypertensive. Hers is due to pregnancy. The pregnancy induced. It was hell when she was carrying that pregnancy. So I think midway the pregnancy, baby got shooting up. At a point, I think even 2 weeks or so before birth, he has to be hospitalized. Then after birth, it has not normalized again, so he was put on BP medication.
Hypertension and diabetes often coexist due to shared risk factors like obesity and an unhealthy lifestyle. Having hypertension or diabetes may increase the risk of developing the other.
With the diabetes, I think it was 3 years ago. That one also, I was having some funny feelings one morning, so I decided to go for checkup. And when I went, my blood sugar level was very high. I think at that time it was 13 point something. A week later when I went, it looks like it was still high. So he told me that we have to start the treatment. So he placed me on medication. And later on too, he directed me to go and see a nutritionist as to the type of food I should be taking in to regularize it.
So we say diabetes and then hypertension are like brother and sister. So when somebody has diabetes that is not properly managed or early detected and controlled, it's able to stimulate some systems in the body to the extent that the blood pressures go up. So when you live with diabetes that is not properly managed or controlled, it can lead to high blood pressure. Yes, it can lead to high blood pressure. And again, if the person develops the two that is not well controlled, it can lead to heart diseases and then brain diseases like strokes and the likes.
So for an individual living with high blood pressure or diabetes or obesity or cancer, the impact comes from various areas. Okay, so first of all, the most common thing is with finances. It puts a big dent in the finances of the individual, in that they have to go for regular hospital visits, they have to buy medication, and the buying of the medication is about 70 to 75% of what the income that they are generating. NCD research that was done in Gamashin, it's about 600, the people earn about 600 cedis per month, okay, on the average. That's the salary that people earn, and they're using about 75% of their salary just to buy medication. That's for those who are living with these NCDs.
In a more recent study that was conducted and funded by the Farm Access Foundation, we realized that at the individual level, it cost approximately 6,266, to control or manage, diabetes and then hypertension.
Also, it impacts on their psychological health, okay? So as they go on, they can get to a point of depression, they get to a point of anxiety. They're living with this disease and they wonder to what end? To what end? And then they say, it gets to a point where they are tired of taking their medication. So then they stop. And sometimes they want alternatives. They want alternative sources of treatment.
Rosemary Boedu's journey with end-stage kidney disease began at the tender age of 13, a time when most children are filled with dreams and aspirations. Hers was overshadowed by the specter of chronic illness. What seemed like a minor discomfort soon escalated into a life-altering diagnosis.
We went to several hospitals. They did not find out what was happening to me. So a friend of my mother introduced a hospital to us to go there. So when we went there, they wrote a letter for my mother to go to another hospital. But then we did not open the letter. And when my mother opened it too, she did not tell me what was in the letter. And so we went to that hospital at home. When we went there, they treated me and I became fine, but I don't know what they told my mother. I don't know that they have told my mother that I have to go for dialysis so that they will do something for me. So now my kidney is no more working. The two of them have been damaged, and the work that is that can no more do it. So I have to go to Kolebu so that they will use machine to do that work for me.
It was only after a series of referrals and mysterious letters that the full extent of her condition became clear. Her kidneys have failed, and her only lifeline was the grueling routine of dialysis.
You have called everybody on your phone. How can you be calling someone every day, every time to ask for money? How would that person feel for you? So sometimes it happens that I'll not go. Even today, tomorrow I'll be going to dialysis. But as I'm here, I'm still thinking about who I go home to call and ask for money. If I do not go, then that means I'll not go. I'm here writing exams. That's what I can do to get strength and walk and sit down for a long time. Then it means maybe I cannot write the exam or come to school. And I don't want that thing to happen to me too.
In younger age group,
did not continue after 2 years due to a business slowdown. Since last year, her daily existence has now been marked by a delicate dance of survival.
Sometimes you get the dialysis man, but the Lord fair you will not get, so you will not go unless the money is up to. Sometimes soon you get the money and the FM can come. When we come back, there is nothing for us to eat again.
She is very academically inclined. She attends school regularly. It's when her health worries her that you would not see her in school. There were times that she would go for dialysis and would want to come back to school immediately after because she doesn't want to lose any
which can help identify risk factors and detect NCDs at an early stage. By removing out-of-pocket expenses at the point of service, experts believe this will play a very crucial role in reducing the burden of NCDs, promote health equity, and improve the overall well-being of individuals. NCDs often require a lifelong management, unlike acute illnesses that may be resolved with treatment. This places a continuous demand on healthcare services and resources, requiring ongoing funding and support from the National Health Insurance Scheme to provide quality care to affected individuals.
The National Health Insurance is what we have available, and so these NCDs are putting a lot of stress on the amount of money which is already not enough, and then more of it has to go into catering for those with the non-communicable disease.
Even if the government is not directly giving enough resources to these patients, the medical doctors employed by the state do provide support for these patients. The health facilities, when they do visit, they pay no consultation fee, or the consultation fee is subsidized. So when we look at all these in tandem, government support may remain quite substantial, but at the same time, inadequate.
If you look at our health sector medium-term plan, which is a 4-year document from 2022 to 2025, we've gone through midway of the implementation. So as we speak, we are even doing midterm evaluation of that plan. When we were developing it, we saw that NCD is becoming an issue. So we put in the document that we need to find data and to be able to quantify the impact of NCDs.
So we can segment this in 3 portions, so to say. So we have preventive interventions, those that are going to prevent people from getting the non-communicable diseases. But if they do get the non-communicable diseases, we have to treat them. So the treatment interventions. And when we're treating the people, we have to prevent them from getting the complications. So the
It's another way of saving the per capita income of that person per annum. And currently, the per capita income of Ghana from the World Bank data 2022 is about 2,203 USD. So if we're able to prevent one mortality, that is at least the amount we are saving. So if you have about 100,000 deaths that are averted as a result of some interventions put in place, then we are saving 1.2 multiplied by 2,203 by that number. I'm not even taking into consideration discounted over time.
The choices we make in our daily lives have a profound impact on our health outcomes. Unhealthy lifestyles, characterized by poor diet and lack of physical activity, experts say, contribute significantly to the rising cases of NCDs.
Emphasis here is that we shouldn't allow the complications to set in before we run around to solve the problem. Prevention is the key. Prevention is the key.
There are a few of them that will still end up in terminal stages. What then it means is that our health financing system should begin to look at how we finance NCDs. Okay, and that's a big conversation that we can have as a country. We need to have a massive campaign to begin to alter our lifestyles. Okay, and for me that is very, very important.
We should definitely encourage our population to be aware about diabetes and cancers and what these are, how they can identify them and how they can prevent them.
I also want to see commitment from our side, I mean government and ministry, with respect to resources. Because if you don't get the resources to the implementing agencies to do that, then we may not see the successes that we want to see from the implementation.
We know what to do, but are we actually doing it? So the practicalization of the knowledge is very important in order to curb this problem. If we don't do it, then we are heading for trouble.
The cost burden of non-communicable diseases in Ghana is escalating, impacting individuals, families, the healthcare system, and the national purse. It is imperative for multi-stakeholder engagement in